One of Singapore's largest hospitals, Tock Seng, will start admitting patients into Ward 9D from tomorrow. The ward was at the centre of the hospital's COVID-19 cluster. Tock Seng has been gradually reopening after shutting for 2 weeks to contain the infection. Deborah Wong with more.
One cluster, 46 cases in 2 weeks of lockdown. Ward 9D is where it all began. Now, the COVID-19 task force is still investigating the cause of the transmissions, but so far, no protocol breaches have been found. However, they're studying the possibility of the infections being caused by poor air ventilation or airflow. And they're also studying the possibility of the infection stemming from unmasked patients and visitors. While the outcome is still inconclusive, what we do know is that the hospital itself has stepped up its own set of safety precautions. Now, inside this ward, what you would see are new HEPA filters. Now, these are high-efficiency air filters that's used to trap pollutants, and they will also have air exhaust fans. And together, these two features actually help to circulate the air in the ward and replace the air every 6 to 12 times in an hour. And outside the ward, what we have here is a donning station. So nurses, before they enter the wards, they need to come to these cubicles to put on their personal protective equipment. Now, they were not required to do so previously. In fact, they were only required to wear surgical masks. And what happens after they exit the ward? Well, they have to come to the doffing station. Now, this is where nurses will have to dispose of their used equipment so as to do so in a very safe manner to prevent any form of cross-contamination. Now, these features will be installed at every ward in Tock Seng Hospital. Besides that, the hospital has also stepped up its swabbing regime.
We also initiated PCR testings for all our in-flight patients, about 1,100 of them, and they have gone through at least 6 rounds of PCR testing. We have also tested our staff, about 12,000 of our staff. They've gone through 2 rounds of testings, and all the results were negative so far.
Now, for vaccinated staff, they would have to be swabbed every 2 weeks, whereas for non-vaccinated staff, perhaps they have allergies, they would need to be swabbed every 1 week. And for patients, they will need to be swabbed periodically. They will also have to remain masked if they are deemed medically fit to do so, and can only receive up to 1 visitor a day within 30 minutes.